Hello, welcome back to the Batteriology course. Today I'm going to talk about Salmonella and Shigella that belong to Enterobacteriaceae family. I'm sure you've already heard about Salmonella. Maybe you've never heard about Shigella because it's less common. But anyway, let's first talk about Salmonella. There are many kinds of Salmonella, as always. Salmonella can cause, for example, enteric fever, gastroenteritis, septicemia with or without focal suppuration. And finally, there are some people who can be carriers. So an infection led by this bacterium can end up with a with a carrier state, actually. Of course, the infection is full of symptoms, so the person is aware of the fact that he is a carrier. Practically, Salmonella has been divided into the enteric fever group with typhoid and paratyphoid bacilli and the food poisoning group. All the different kinds of Salmonella are gram-negative. They are Rhodes and motile, except in some cases. Some of them are aerobic, others are facultative anaerobic. They grow rapidly and in simple media, so they don't need so many molecules, so much energy to live and to grow, to replicate. The media that is frequently used in laboratory in order to make it grow is called Mcconkey Agar, and this media is usually used for all the other bacteria belonging to Enterobacteriaceae family. Which are the main antigenic structures? Well, first of all, flagella antigen H, somatic antigen O, and surface antigen V. H antigen is heat labile, it's immunogenic, and it induces antibody formation. O antigen is heat stable and it's basically a phospholipid, while V antigen is analog to K antigen and it's heat labile again. V polysaccharide acts as a virulent factor by inhibiting phagocytosis, resisting complement activation, and bacterial lysis. The total absence of V antibody in a proven case of typhoid fever indicates poor prognosis. It means that the patient is about to die very soon. Antibody disappears early in convalescence, and their persistence indicates development of carrier state. A peculiarity of Salmonella is the antigenic variation. For example, H2O variation is associated with loss of flagella and so loss of motility. Salmonella can cause many different diseases like enteric fever, typhoid fever, and paratyphoid fever. Salmonella typhi is responsible for typhoid fever, while Salmonella paratyphi type A, B, and C usually cause paratyphoid fever. Usually, the incubation is about 7 to 14 days, and the symptoms are headache, malaise, anorexia, and abdominal discomfort like constipation but also diarrhea, hepatosplenomegaly, rose spots in skin which blanch on pressure, and the complications can be perforation or circulatory collapse. Relapse may occur in convalescence, and they are higher if treated early with chloramphenicol, which is a kind of antibiotic. Paratyphoid is a milder form of typhoid fever. It leads to frank septicemia with suppurative complications. The diagnosis is a laboratory diagnosis with the isolation and demonstration of antibodies or of bacilli. The diagnosis is made in laboratory with the isolation and demonstration of antibodies and of the presence of the bacilli. The diagnosis can also be done with blood culture. The treatment is usually made with antibiotics like chloramphenicol, tetracycline, streptomycin. The treatment is usually made with antibiotics like chloramphenicol, tetracycline, streptomycin, ampicillin, and others. There is a specific kind of Salmonella called Salmonella gastroenteritis. It causes enterocolitis and food poisoning in general. It is caused by any Salmonella actually, except the Typhi Salmonella. The incubation is really short, is within 24 hours, and the symptoms are vomiting, abdominal pain, fever, loose stools actually. The treatment, if the infection is not so complicated, it can be done without the use of antibiotics. It's just made by a supportive therapy. What about Shigella? Shigella always belongs to Enterobacteriaceae family, so it's a gram-negative bacillus. It usually grows in the presence of oxygen, but it's also able to grow without the oxygen. It's metabolically active, fermenting a variety of substrates. It's mostly non-motile, non-sporing, and non-acid fast. So Shigella is facultatively anaerobic. Since it's not motile, it doesn't have the H antigen. It possesses a capsule, so it possesses a K antigen and O antigen. It's non-lactose fermenting and it's bile salts resistant. Then it's able to reduce nitrates and it's oxidase negative. Which are the most famous and important species of Shigella? Shigella dysenteriae, that causes the most serious form of bacillary dysentery. Shigella flexneri, that causes shigellosis in underdeveloped countries. Then Shigella sonnei, that causes shigellosis in developed countries. And Shigella boydii. The classification of Shigella divides it in 4 groups where we have different species based on different O antigen and some biochemical reactions. In group A, for example, we have Shigella dysenteriae. We have actually about 10 kinds of Shigella dysenteriae. In group B, we have about 6 types of Shigella flexneri. In group C, we have about 15 types of Shigella boydii. And in group D, we usually gather the different kinds of Shigella in 4 groups, depending on difference in O antigen and some biochemical reactions. We have group A, where we find, for example, Shigella dysenteriae and other about 10 types of Shigella. In group B, we have about 6 types of Shigella flexneri. In group C, we have about 15 types of Shigella boydii. And in group D, we have Shigella sonnei. The clinical syndrome is called shigellosis, and it ranges from an asymptomatic infection to a severe bacillary dysentery. It's a 2-stage disease. So, first of all, it's characterized by watery diarrhea changing to dysentery with frequent small stools with blood and mucus, tenesmus, cramps and fever. The early stage is represented by watery diarrhea attributed to the enterotoxic activity of the toxin specific of Shigella, which is called Shigatoxin. We have fever attributed to neurotoxic activity of the toxin. So let's analyze step by step the infection. First of all, we have the ingestion of the bacterium. Then we have the non-invasive colonization and cell multiplication. Then we have the production of the enterotoxin by the pathogenic bacteria in the small intestine. The second stage, we have the adherence and tissue invasion of the large intestine and all the typical symptoms of dysentery. And then we also have a cytotoxic activity of Shiga toxin that increases its severity. Shigellosis is a major cause of diarrheal disease in developing countries. It's also a major cause of bacillary dysentery, which is a severe second stage form of Shigellosis. The leading cause also of the infant diarrhea and mortality in developing countries is always represented by this bacterium. Shigella infections spread from human to human via the fecal-oral route. Less frequently, the transmission occurs by ingestion of contaminated food or water, and the outbreaks usually occur in close communities. Secondary infections are really common. The incubation is really short, it's about 1 or 3 days, but the most dangerous thing, the most dangerous aspect of this infection is that the person who has been infected is a carrier of the bacterium for approximately 1 month following convalescence. Talking about the pathogenesis in a more specific way, we have to say that bacterial cells preferentially attach to and invade into M cells in pairs patches of small intestine. Do you know what M cells are? The M cells typically transport foreign antigens from the intestine to underlying macrophages. Shigella can lyse the phagocytic vacuole called phagosome, and it's also able to replicate in the cytoplasm. So let's talk about the pathogenesis in a more specific way. Bacterial cells preferentially attach and invade into the M cells in pairs patches of small intestine. Do you know what M cells are? Well, the M cells are a typical kind of cells of the epithelium, of the intestinal epithelium, and these cells typically transport foreign antigens from the intestine to underlying macrophages. So Shigella can lyse the phagocytic vacuole, also called phagosomes, and replicate into the cytoplasm. Toxin is neurotoxic, cytotoxic, and enterotoxic, and it's encoded by chromosomal genes. What is the enterotoxic effect? Well, Shiga toxin adheres to the small intestine receptors and blocks absorption, that is the uptake of electrolytes, glucose, and amino acids from the intestinal lumen. The cytotoxic effect occurs because the B subunit of Shiga toxin binds host cell glycolipid in large intestine. It inactivates the 60S ribosomal subunit and it inhibits protein synthesis. The neurotoxic effect is shown with fever, abdominal cramping essentially, and other symptoms related to the nervous system. The main problems to attend are dehydration caused by this kind of infection and antibiotic resistance. Nowadays we have oral vaccines of Shigella that offer immunity for 6 months to 1 year. So that's all for now. See you then. Bye.